Good afternoon, everyone. This is health class number 29, and it's March the 12th, 2011. This is part 2 of understanding the lab reports. I don't know if you guys were here last week for lab reports. I'll send that. Did I send it to you? Okay. Okay, we're going to continue. Just one question. Do you remember what the levels for vitamin D should be? Not less than what? No. Vitamin D, not the cholesterol, not the LDL. You're thinking of LDL. We want it to be greater than 50. Okay? And if they're autistic, 50 to 80, 80 to 100 minimum. This is for autistic children, but greater than 50 for everyone, your average person. Most people are running around 18 to 22. Everyone I talk to, their ranges are in between here. That's very low. Yes, that's extremely low. And people will have multiple sclerosis and depression and you name it. Cancer, breast cancer. In every disease, they're finding low vitamin D levels. Okay, now, CBC. Does anyone remember what CBC stands for? Complete. That's right, blood count. Okay, now, in Leviticus 17:11, we're told the life of the flesh is in the blood. That's why they check the blood. That's where the disease, that's where you could tell if something's going on with someone. Some people are against blood tests. Sister White says we're not inferior to the exams of our day. She even encouraged blood transfusions. Now, how can you give a transfusion to someone if you don't know what's in their blood? You know what I'm saying? So we don't want to be fanatical. I do recommend if somebody's extremely sick and you don't know what's going on, you can tell them to go get a blood test. Doctors are doing them every day. And then you can go by what's on that. Okay, the CBC, white blood cell count. This is part of the immune system to combat infection, inflammation, cancer. It should be, so for CBC, you have WBC, which equals white blood cell count. It should be 4,000 to 10,000. Now, these vary from hospital to hospital and lab to lab. But that's your average right there, 4,000 to 10,000. Cortisone elevates the white blood cells. Cortisone is a steroid. It's a medication that they give. Okay, an average vegetarian normally runs high 3,000 to low 4,000. So we're going to be on this end, okay? And you might even be 3,800 or something. Don't freak out. Our labs, because who are they testing? Standard Americans, right? Are they healthy? No. So our labs are normally always lower, or if they're supposed to be high, they're always on the higher end. All righty. An acute infection like bacterial infection, the white blood cells rise. So you'll be 11,000, 12,000, 13,000 for an infection. Neutrophils, these are part of the white blood cells, are the ones that usually respond in viral infections. Now let me ask you a question. Do antibiotics take care of viral infections? No. But they give them, but they prescribe them. They prescribe them left and right. But if you go to a Merck manual, a physician's desk reference, which is called a PDR, it'll tell you antibiotics do not kill viral infections. But what kills viral infection? Garlic. It's the #1 antibiotic. Golden seal is a great antibiotic. Echinacea. You have to be careful with golden seal in pregnant people, and you have to be careful echinacea on a regular day basis. It's antiviral as well. Antiviral, antibiotic, antifungal. Yes. Tea tree oil is very good, but garlic is the #1. Okay. In viral infections, you may see a little bit of rise in the white blood cell count, a normal count, or a depressed blood count. So even if someone has a viral infection, that might not affect this. It can go up a little bit. It can even go down a little bit. Not a predominance of neutrophils, but of lymphocyte. Now, If you see more lymphocytes than you see neutrophils, lymphocytes are part of the white blood cells. You've got basophils, eosinophils, neutrophils. You have your leukocytes. Leukocytes are part of your white blood cells. They, when you see more leukocytes than you see neutrophils, you've got serious problems. Though that's an indicator something's seriously wrong. What'd you say, brother? That's right. In certain blood-borne diseases, you can get abnormalities in these white cell ratios. If it is seen that there's a slight increase in the white count, but if the lymphocytes predominate, they say it's a red flag. Because normally your neutrophils are to be in predominance over the lymphocytes. It can be a precursor to a disorder, serious like cancer, something serious, leukemia. When those leukocytes are higher, neutrophils, I'm saying the wrong, lymphocytes. When the lymphocyte, not the leukocytes, when the lymphocytes are higher than your neutrophils, that's a red flag to the medical profession. So when you check people's lab work, if they say, can you look at my lab work? It'll say if it's high or low on there, but it'll teach you too. Because some people might want you to explain it to them. Okay, so that's A. B is hemoglobin. We're dealing with the complete blood count. This is what they check. Hemoglobin. What does this reflect? Anemia. It reflects anemia. You have different types of anemia. You have pernicious anemia, which is a B12 deficiency, which runs very dominantly in Native Americans. I know because it runs in my family on my dad's side. You have your regular type of anemia. There's like 5 or 6 different types of anemias. What does anemia mean? Low iron. That's right. It's low iron. When you see the word A before a word, it means without. Okay? In most cases, this is like a prefix. It reflects anemia. It's that part of the red blood cell that contains a protein fraction and an iron fraction. The heme portion, that's where you get hemoglobin. That's why they call it hemoglobin. Globin equals the protein. Heme equals the oxygen. That's what carries the oxygen. Globin is the protein. That is the part in the red blood cell that carries the oxygen. If you have hemoglobin, it is normally a reflector. If you have low hemoglobin, it is normally a reflector of a low red blood cell count. And you are anemic. This is normal levels. Women should be, and once again, these vary from lab to lab. Women should be 12 to 16. I had a friend come to me with a 5. Is she low? Yes. Now, I've seen doctors give blood transfusions for a 7. They turned her away. I said, I believe the Lord is trying to show you something, because they would normally give her a blood transfusion. I said, I'm surprised. Now, the light of the body is what? The eye. Do you know you can check a lot of things of the body with the eye? Do you know what part of the eye you check to see if somebody's iron is low? No, not the sclera. No, not the sclera. That has to do with your liver. The very bottom. This very bottom. If it's pale, they're low in iron. It should be like a reddish, like you should see like bloody tinge in there. That means your iron is high. But if you see it like a light pink, or light pink means their iron is not as good as it should be. But pale, yes, pale is they're extremely anemic. And my girlfriend was white. Look at each other. Look at everyone's eye at the bottom. Look at your colors of your eye. Do you see red? Did you see his? Did he have red? Yeah. Little bit? Okay. Yeah, you should probably have him checked. But you can give him the iron building drink. So that's how you tell. Well, she said, what do? I said, the Lord is trying to show you. So what did we say we do for anemia? Why? Why blackstrap molasses? Not just any molasses. It has to be blackstrap. And what's the best brand? There you go. Plantation. It's a yellow label on the front. This is the only one I know of. They have others, but I'm kind of leery. Iron and herb is good for anemia. Iron and herb. It's called iron and herb. Iron and herbs. And where do I tell you guys to order your stuff? Vitacost. Very good. Now, if it's bulk herbs like charcoal, vitamin C powder, we'll go to Amera Herb. And I have that phone number if you guys need it. It's in all the papers I give you. Iron and herbs, beet juice. Now, we don't agree with juicing on a regular occasion, but if somebody's anemic, now here's another remedy. I don't recommend it in 2011, but you work with what you have. You get eggs of healthy chickens. Okay? So what color eggs are those going to be? Eggs of healthy chickens. Now, when she gave this remedy, she did say there's going to be coming a time where eggs are not going to be healthy. We had that scare back in August. How many eggs were recalled? 500 million. That's a 500 million. Is that a lot of eggs? But you work with what you have. Eggs of a healthy chicken, and what do you drop it in? That's right. Plus grape juice. Welch's grape juice is pure. And you drop one egg raw. She said this is a great blood transfusion. She recommended the blood transfusion at the time, but she said if you can't get it, do this. But we know other things now since then. There's a lot of other things you can do. I myself would be very leery doing this because of the salmonella and E. coli and stuff. Another thing that will cause low hemoglobin is overhydration. Are we going to be overhydrated compared to your average person? Yes. So are we going to be on the lower end or the higher end? If we're following the laws of health and we're drinking plenty of water, because the world says you're not supposed to have clear water, clear urine. But our health experts will tell you your urine should be clear, should be pale. So they would consider that overhydration. That's not, we know. We're actually dehydrated. So we're going to be on the lower end. And I just wanted to tell everyone, I went and saw Forks Over Knives Tuesday night in Loma Linda. Brother Diston went too, huh, Brother Diston? How was it? I was in tears. I mean, I kept crying and crying at the very end because I said, man, when this gets out in the theaters, this information is going to save so many lives, and it's going to open the doors for us to really be able to teach. Because they think we're weird about vegetarianism, but it's getting very popular. Bill Clinton and all these famous people are starting to adopt it, so now people are starting to follow. Okay, let's keep going. Another part of the complete blood test is called Hematocrit. Have you guys heard of this? Hematocrit, they normally do what's called an H and H, hemoglobin and hematocrit. It's still part of the blood count. Sometimes they might just do this because you might be bleeding or something and they want to check this. It's called an H and H. Hematocrit, a ratio of the red blood cell mass to the liquid compartment of the blood, both usually go down in anemia. The hematocrit is usually 3 times the amount of the hemoglobin. Okay, now MCV. We're still dealing with the blood count. You're going to see what's called an MCV. Brother Diston, do you know what this is? Do you know what that stands for? Mean corpuscular. When I say corpuscular, what do you think of? Corpuscular has to do with those blood cells. Mean corpuscular volume. And what this is, it has to do with the size of the red blood cell. As the red blood cell gets smaller and smaller and smaller, the MCV gets less and less and less. As it gets larger and larger and larger, what happens to the red blood cell? When this gets smaller, red blood cell is smaller. When the red blood cell is bigger, this number gets bigger. Okay, so this is just telling you the size of the red blood cell. By looking at that, the physician can tell how to categorize the anemia. Remember I was telling you there were several types of anemia? They go by the size of the red blood cell. Most anemias are normal, meaning the MCV is normal. in most anemias. If you have an iron deficiency from a female cycle, okay, that's going to go down, right? Because females lose a lot of blood. The elderly lose blood in the stool. This number will go down. Okay? The elderly can lose blood from the bowel. If it's 10 and she has heavy bouts of bleeding, the person needs iron-rich foods. What did we learn were some iron-rich foods before? What'd you say? Yes, greens, beets, lentils are extremely high. Pistachios are the highest in iron of the nuts. Sesame seeds are high in iron. Yes, grape juice is great. Grapes are great. Red grapes. Raisins, dates. Those things are high in iron. Okay. Some of your, it says if the lady's 56 and she's anemic and hasn't had a cycle in many years, in other words, she's not bleeding on a regular monthly basis like your average woman would, and she's anemic and has an MCV that's low, it said there could be some occult bleeding going on in the bowel. So if she's got a low blood count and the MCV is low, but she has gone through menopause already, then they're going to look at the stool for occult blood to see if there's some type of bleeding going on in the colon or something. You guys getting that? And I'm going to send this to you. The MCV lets us know what types of anemia are most likely in that person. Some of your inherited anemias, when the MCV is very small, think of an inherited hemoglobin problem. If you start to get large red blood cells and the MCV is going up, but the total blood count like the hemoglobin and hematocrit are going down, so let's say this goes up, MCV goes up, but the hematocrit and hemoglobin are going down, this is an indicator of diseases like B12 deficiencies. So this is what the doctors look for. Okay, this is going up, but these are down. Now we learned if you're anemic, chances are this is going to go down, right? But if it goes up, then they say it's a B12 deficiency, not so much an iron anemia. Okay, so let's keep going. Now another thing that they check for when they do a WBC is called a platelet count. Who knows what that is? What are your platelets? That's right. And you have intrinsic factor. This helps with the clotting factor. This is for clotting. Do you know, when you look at the human body, you cannot say we poofed into existence because there are factories in our bodies. When you eat nutrients, the blood will say, okay, we're going to the liver, and this one goes to the heart. It knows exactly where to transport the nutrients in the body. Now, only a creator who designed the body can do that. And it's the same thing with the platelet. You start cutting, and guess what happens? You have a clotting factor, and they're called your platelets. You have platelets, which start the clotting process. If your platelet is low, what's the name of a person who bleeds a lot? The hemophiliac. That's right. That means, do they have good platelet? No, they don't have good platelet. And then they look at words like called PT and PTT. You'll see words like this, prothrombin time, prothrombin time. This looks at how fast you clot, how much you're bleeding. These are different tests that they do. Now let me ask you a question. What can help the platelet factor start? If someone is bleeding internally and their platelet count is low, what could you give them to help their platelets? There, you said it. Say it louder. Cayenne pepper. Do you know cayenne? If you look at the things that God made, there's no way that man could do what God did, because you could take cayenne, and if a person is bleeding to death, it will stop the bleeding. But if the person is clotting, it will unclot it. It will do the platelet, and it will do the bleeding if you need it. It will unclot, and it will clot. It will do opposite. It goes into the body, and it says, you need to be clotted, I'm going to clot you. You need to be unclotted, I'm going to unclot you. Man cannot make anything that does that. Nothing. They can't. So cayenne pepper, Put like a half a teaspoon in some warm water, and person's hemorrhaging, have them drink it. What do you say? And have it, because only God can do that. Can we figure out the things of God? No, no. Only God can do something like that. The platelet count. Platelets are those substances that float around in the blood cell which help the blood to clot, and you can get certain problems with low platelet counts, high platelet counts. You may see primary disorders where there is an overproduction of platelets that cause a pre-malignant or malignant disorder. So if you have too many platelets, you can get malignancy. What's malignancy? What do I mean by malignancy? Cancer, a growth. You may see platelet counts that are low for a variety of reasons. Certain infections, like hepatitis or chronic hepatitis, will cause low platelet count. They may have a low platelet count. There can be certain autoimmune disorders that consume platelets, like idiopathic thrombocytopenia purpura. You ever seen people with different spots, like red spots? Have you seen that? That's a sign of bleeding. Or if you give somebody a shot, when we used to give shots, we had to check the injection site because there could be internal bleeding. If you see someone with a lot of bruising, that means chances are they're internally bleeding. Now, what are some medicines that they're giving that's causing this bleeding? What's an over-the-counter medication that you can get that causes bleeding? Aspirin. Aspirin can cause bleeding. And it's also known as ASA. That's the abbreviation for it. Warfarin. They give warfarin also to help people stop smoking. Did you know that? Yes. But it's a blood thinner. Coumadin, this is the most common. If somebody's on dialysis, they'll give them heparin. I think I'm saying it right. Something like Lovenox is a blood thinner. It's injectable. These are things that thin your blood. Now, when you're dealing with people and you notice their skin, like they might, like the elderly, have a lot of bruises, it's because they're on one of these medications. So you need to be familiar with that, look and pay attention, and ask them, are you on any blood thinner? And if they say yes, say, I think you need to go to your doctors and get your PT/PTT checked. And if they say, what is that? Just to see if you're bleeding too much internally. All right? Alrighty, let's keep going. Okay, RDW is a red blood cell distribution width. It's a measurement and dimension of the red blood cell. It has to do with mixed types of anemias like B12 deficiency and an iron deficiency. It gives a clue because the RDW is increased. So when the RDW, which is the red blood cell distribution width, goes up, then that's a sign also. Remember we talked about the MCV, the mean corpuscular volume. As that gets bigger, that's a sign of B12 deficiency. This is another one they check. And these are just things that you find. Now you see all these letters and you're like, what is that? What is that? What is that? That's what these are. Eosinophils is a type of white blood cell. I mentioned that earlier. They're produced in the bone marrow. Now, let's talk about the bone marrow. This is my bone. Now it's kind of funny looking. It's a bone. Where's the marrow in the bone? That's right here in the center. What color is marrow? Yellowish. Isn't marrow? Epiphysis. Red blood cells are here. But the marrow is like a yellowish color. It's here. Did you know this is where your red blood cells are made? Now, the life of the flesh is where? In the blood. What do we learn in Sabbath school and church? A valley of what? Dry bones. What is that going to do to your marrow? That's right. Merry heart is good like a medicine, but a what? Dry at the bones. So if the red blood cells comes from here, okay, The marrow is where production starts. And this is dried up and you're depressed. Is that going to have effect on your anemia? Is that going to have effect on your blood cells? Absolutely. It can have an effect on infection. If you're depressed, you won't heal like you should with infection, anything having to do with blood cells. So this is where the marrow is, in the center. The Bible talks a lot about marrow. Look it up. Look up the word marrow and see what can have an effect on your marrow. Life of the flesh is where? In the blood. Where's the blood made? That's right, over here in this part of the bone. So do we need to take care of our bones? Absolutely. We don't realize how one thing is connected to the other thing. We don't realize that. So what are some things that are crucial for the bone? But in order for the calcium to do what it needs to do, what else do we need? Magnesium. And what else do we need? Vitamin D. See why the laws of health are so important? And we can't neglect, because if we neglect, it affects the bones. And if you have an excess of calcium, you can have problems as well. Okay, let's keep going. Now, here's another one. And you men with wives, you're going to hear this a lot as they get older. Does anyone know what TSH stands for? Thyroid stimulating hormone. Now let's talk a little bit about this. What is a crucial element that we need for proper thyroid function? Iodine. Did you guys know that? And if you want to find out if you're iodine deficient, go get some pure iodine from a pharmacy. Paint a quarter size on your foot or your stomach. And if in 24 hours it's completely absorbed, you're very deficient in iodine. Now, when I was a little kid, and Pastor, I found out you weren't much younger than me. I thought you were like very young. I didn't realize you look great for your age. But you're not much younger. So do you remember your mom using iodine for your cuts? Yes. They don't do that anymore. They get the Neosporin and stuff, but they used to use iodine. They had it in the classrooms. The kids said, I got a cut. And what color, what would it stain? What color? Like a yellowish, orangish color. Yes. But that's how you can check yourself to see if you're iron deficient. Now, what foods do we need for iodine? Salt. But what kind of salt? You can use the Celtic salt, you can use the real salt, you can use the Himalayan salt. All three, the Himalayan is a lot more expensive. I think the Celtic is a little less expensive, but I've heard that real salt is the best of all of them. And so, now, if someone is deficient, I'm not into seaweeds, because the Bible said, does the Bible say eat the herb of the sea or of the field? Field. I feel, and there's so much mercury in the ocean, but if somebody is very deficient, I might give him some Norwegian kelp or dulse, D-U-L-S-E. Those are two of your top seaweeds that are extremely high in iodine. But you can get the real salt and help yourself with the iodine. But when people have a thyroid-stimulating hormone, now let me tell you something. My relative, I won't say who it is, she has an overactive thyroid. Guess what she ate every day? She ate salt. She ate table salt. If you eat too much of it, will it make you have too much iodine? And if you have too much iodine, that's going to put your thyroid overactive. But if you have too little, it's going to make it what? Underactive. But guess what else can have an effect on your thyroid stimulating hormone? Lack of exercise. You know, I hear women all the time, obese women, say they blame it on the thyroid. Oh, it's my thyroid, because you're not walking. If you start walking, this is going to start acting normal. But when we don't walk and we're deficient in certain minerals, then this is going to be, and so they'll take the thyroid out and surgically remove it. Now, is that kind of excessive and extreme? I wouldn't want them to do. Yeah. Yes. It's not something you want removed. Do we need all the organs in our body? Absolutely. I've heard my grandmother had a splenectomy. I could talk about her because she's passed now, but she said, oh, I don't need my spleen. Well, back then I didn't understand because I wasn't a Christian, but I understand now. We need our spleen. If we didn't need our spleen, God wouldn't have put it in there. They say we don't need our appendix. Well, yes, we do. We need our appendix. Otherwise, the Lord, see, that's coming from an evolution who doesn't believe in a creator. But when you believe in a creator, then you believe you need your appendix and your spleen. Now, what is appendicitis a sign of? What is appendicitis a sign of? Over-impacted bowels. So what do you need to stop doing? You need to stop eating. You need to fast. Do a castor oil pack over the appendix. Some people will do an enema. If you're not my relative, I wouldn't do one on you because if it busts, I don't want to be responsible. But you want to empty your bowels. You want to take an intestinal cleanse to help clean out your bowels. It's just an over-impacted colon. Just stop stuffing yourself. Okay, let me tell you a little bit about the thyroid-stimulating hormone. We're almost finished. The normal ranges for the TSH is 0.4 to 4.5. Now, is this going to be the same at every hospital and doctor's office? No, the figures will vary. It says the TSH levels come out of the pituitary. Who knows where the pituitary gland is? In the brain, right? It's in the brain. And what triggers the pituitary? Let's just look at how the body works. 1 Corinthians 12 talks about the members are connected, right, of the body. The pituitary is where? It's in the brain. What triggers it? The sunshine. That's right. She got it. The sunshine. And the pituitary is responsible for many hormonal functions in the body. But in order for those functions to take place, you have to get the sunshine. Because you need the vitamin D, which is responsible for how many functions did we say? 2,000 plus. He remembered. That's right. 2,000 plus. One of those, if you're deficient in vitamin D, do you think you're going to have a problem here? If the pituitary is what does this? Absolutely. Absolutely. So another thing to look at is, are they deficient in vitamin D? Because you fix the vitamin D and a lot of times this will go away. Because I hear people say, I eat real salt. I eat enough iodine. I do Norwegian kelp. How much sunshine do you get a day? They don't get any. Okay, let's keep going. Alrighty, it says, the TSH level comes out of the pituitary. It drives the thyroid. If the thyroid gland is not functioning well and doesn't put out the normal hormones, who knows what the normal thyroid hormones are? Thyroid hormones. And women my age, you're going to hear a lot of these problems. These are the thyroid hormones, T3 and T4. Thyroxine, thyroxoid. I'll give you the proper names. T3 and T4. The brain senses that, and the pituitary will release increasing amounts of stimulating hormone. But as we learned earlier, the vitamin D is what helps the pituitary to release it. It will act upon the thyroid and try to stimulate it to produce more hormone. One of the earliest signs of hypothyroidism. So what would hypothyroidism mean? Low thyroid functioning. Hypothyroidism is one of the earliest signs of hypothyroidism is normal levels of thyroid hormone. This will be normal. Thyroid hormones will be normal in the beginning stages. But a rising of the TSH level. So these will be normal in the beginning stages of hypothyroidism, but this will increase. Is that understandable? That's called a subclinical hypothyroid. It will finally come to the point where the gland cannot keep up enough with that driving thyroid stimulating level, and it will fall even though the TSH level is there. If you see a high TSH level, what does TSH stand for? Thyroid stimulating hormone. Let it be an indicator that a hypothyroid state is coming on or is present. These don't have to be abnormal, but if this goes high, that means hypothyroidism. Okay? What is the main cause for an underactive thyroid? We talked about low iodine, not enough vitamin D, exercise, correct? Following the laws of health. Now, what's another test? This is another test. B12. B12 deficiency. If you're B12 deficient, what does that mean? What does the prophet of the Lord say? In fruits, vegetables, nuts, and grains contain all the elements necessary to make good blood. Is this an element? So if you're B12 deficient, what does that mean? You're lacking. And will yesterday's food sustain you for today? It could hold you over maybe one day. If I ate yesterday a lot, I might be able, but can it sustain me for 3 and 4 days? No, I'm going to be starving. I remember when I quit smoking back in many years ago, I went through withdrawals, okay? I didn't eat for 4 days. I couldn't eat. I was doing this, and I was cramping. It was worse than a heroin addict withdrawal. They say getting off cigarettes is worse than getting off heroin. Guess how much weight I lost in 4 days? 15 pounds. Now, don't you think if it was easy for me not to eat for 4 days, I'd do it and try to lose 15 pounds? It's not, but a lot of times we don't supply those 4 food groups. We might have fruits and vegetables and some canned meat, veggie meat. But we left out the nuts and grains. After so many days, we're going to start having medical conditions. We're going to say, like, why do I have this headache? Or why do I feel sluggish? Or because we're not eating from the 4 food groups. What are the 4 food groups? Let's do our pyramid. We'll do a pyramid, but we'll do a real pyramid. What's our 4 food groups? What should we eat the most of? No. We should have more grains than anything, is what they say. Well, I will follow the Bible. We're to eat fruit freely. But grains, we'll put grains as well here, okay? How many servings of grains do they say we need a day? 6 to 11. I don't think we need that much. I think if we eat that much, we're overeating, to be honest with you. I think 6 to 11 for people who are on an animal diet. But for us, I don't think we would have to eat way too much to get that much. But I would say at least 3 grains, 3 to 4 servings of grain. But 1 cup of oats or 1 cup of rice is 2 servings. 2 slices of bread is 2 servings. You can actually get 6 with no problem. You don't need to overeat. Have 2 slices of bread, a cup of oats in the morning, and a cup of rice in the afternoon. You've had your 6 servings. But I think that's about all we need. Fruit, how many fruit should we have a day? 3 to 4. Okay, how many vegetables should we have a day? This should actually be like at least 3 a day. And you know what they say we need? We need a yellow vegetable and 2 green. So name me some yellow vegetables. It isn't, it's a fruit. She's right. Anything with a seed is a fruit. Did you know that? The fruit-bearing seed within itself, if it has a seed inside of it, it's a fruit. Pumpkins are a fruit, tomatoes are a fruit, avocados are a fruit, olives are a fruit. A lot of people don't know that. Yes, squash, pumpkin. Yes, pumpkin is a fruit, yes. You can include that as your vegetable, or some people include it as a grain. But when I say this, I'm talking about carrots is considered a yellow, and even though it's orange. Okay? But you need 1 yellow and 2 green. Name me some green. We have a whole bunch of green. If God has a lot of green, does that mean he intends for us to eat a lot of green? Absolutely. Kale, spinach, mustard green, collard greens, lettuce, romaine, you name it. Yes, we need 2 of those a day. Now, how can we get all this at one meal? There you go. Yes, cabbage is a green one. Thank you, sweetheart. You can make a beautiful cabbage and you can put more than 3, but you need at least 3. Okay? So we have fruits, vegetables, grains, and what else do we need? Nuts and seeds. Very good. Now, this is the smallest, right? We should be sparing. How much of the nuts? 1/4 cup or a closed fist. Or how about 2 tablespoons of seeds? Okay? Chia seeds, flaxseed, ground flaxseed, pumpkin seeds, sunflower seeds, sesame seeds. You guys get it? Okay. So if you're B12 deficient, and Dr. Neil Nedley just talked about this a couple weeks ago on the Weimar site. He said that they're now finding that vegetarians have more B12 than meat eaters. So they're giving them what? B12 injection. But that comes from an animal. We don't want that, do we? No. We don't want that. Okay. So in fruits, vegetables, nuts, and grains contain all the elements necessary to make good blood. These are the levels. These are the normal levels for B12. Anywhere from, it's a big range, 200 to 1100. It says you can have clinical B12 deficiency states with levels, they said 350 to 400 in some patients. Even though this is normal, in some patients, if they're this low, they're considered B12 deficient. I don't know how they figure that out, but that's what they say. If they suspect a person has B12 deficiency, they do another test called an MMA, which is a methylmalonic acid test. This will be high if there is a cellular level of B12 deficiency. So if you're this level, they'll say, you know what, let's do an MMA just to make sure, because she has all the signs and symptoms of a B12 deficiency. And then if this is high, then they label you as B12 deficient, even though the serum levels may be within normal ranges. Now, you will see a high B12 level if a person is taking too much of this supplement. They say they only need 6 micrograms a day, but we don't want to take micrograms of B12, do we? What do we want? Fruits, vegetables, nuts, and grain. When you combine all those, you get your B12. Okay, we talked about vitamin D earlier. Now, the last thing we're talking about, do you guys remember when we talked about this one class? I know Brother Diston knows this. What is this, Brother Diston? But what are they checking for? Why do they have an abnormal sedimentation rate? Do you remember? Inflammation. Inflammation in the body. When someone says they're achy and painy, they're looking for the sedimentation rate. An ESR is another word that they use, which is called erythrocyte sedimentation rate. Normal ranges, men should be 0 to 15, and women should be 0 to 20. Anything higher than this, what are they going to be? They're going to be inflamed, right? So tell me some people who would have excess levels of sedimentation rate. People who have arthritis, people who have rheumatism, people who have osteoarthritis, any type of arthritis, right? Absolutely. If they have inflammation in the body, what if they have an inflamed type of internal organ? What if their heart is inflamed? Yeah, an enlarged heart. When these levels are higher than this, that's a sign of inflammation. Okay, let's keep going. This test, we said, is to check for the inflammation in the body. They say it's a very simple test. Blood is put in the tube. This is what they do. They put blood in the tube and they stand it up. And they said, you watch how fast it sediments in 1 hour. The blood falls faster when there is inflammation in the body, cancer, or infectious diseases. So when you see the blood going down quickly, that's a sign of cancer, inflammation, and infectious diseases. Because cancer is also inflammation. Did you guys know that? It's inflammation in the body. Anytime there is a high sedimentation rate, it doesn't say what is wrong, but it tells you there's something wrong. So they check in other areas to find out what exactly is going on. Example, lupus, which is an autoimmune disease, will cause the sedimentation rate to go up. Let me see what else. It says lupus will cause it to be high, but the doctors don't know right away. Just because a person with this disease has joint problems, they think that lupus is what they're faced with, but that's not always necessary. So whenever somebody's having inflammation, now I just wanted to make this one point and we'll be finished. In order to have good health, what are we told you must have? Good circulation. Is inflammation good circulation? No. What is one of the main 2 things we are told, actually main 3 things, of the laws of health, that if we do this, this will cause good circulation? Exercise. What else? Water. What else? Fresh air. That's right. Do you know if you sleep with your windows at night, you can have very bad blood? And if you have bad blood, are you going to have good exercise? Good circulation? No. So if you know somebody suffering from arthritis, now, what did we learn inflames the body for 30 days? What did you say? 1 egg can inflame the body for 30 days. Just 1 egg. I know somebody who always has arthritis. They eat eggs all the time. 1 egg. Meat can inflame the body. Barbecues can inflame the body. Why can barbecues inflame the body? But the nitrites and the nitrates, okay? Anything with a face, a liver, a mama, will inflame the body. Seriously. So when you're dealing with people with arthritis, if they're talking to you, how can I get my sedimentation rate low? Talk to them about water, exercise, air. Now, what if they tell you they're in so much pain they can't walk? But what would be the question that you would want to ask them? No, I'm saying if they said they can't walk, like they're in too much pain to exercise, what would you ask them? Let's say you told me your sedimentation rate is high, and I said, oh, I'm tired of, why is it like this? And I'm tired of being in pain. Can you tell me what's wrong with me? You tell me I'd eat eggs, right? And you would tell me I would need more water, and I would need fresh air, and I would need exercise. But then I said, oh, but I can't exercise. I hurt too much. What would you ask me? No. Good try. How much do you think you can walk? Can you walk a minute? That would be insulting to some people. Of course I could walk a minute. See, when you tell them to walk, they're thinking you're telling them to walk an hour. That's what they think in their mind. But start with them where they are at their level. Can you walk a minute? Of course I could walk a minute. I could walk at least 2. Tell them, okay, get a timer. Set your timer for a minute. Walk out of your house. Just keep walking. And when that timer goes off, turn back home. Mentally, you've done 1 minute, but you've really done 2. If they tell you 2, put 1 and have them do 2. And tell them to increase 1 minute each day. But sedimentation, they got to get moving. So that's why. Now, any questions? We didn't cover every single lab because there's just a lot, but these are the main ones. Yes, brother? Absolutely. Do you know why? Poor circulation from what? Not only that, buildup of sugar. If you have too much sugar in the blood, it thickens the blood, right? There's too much sugar in there, so the blood is getting... If you were to take some water, okay, and just stir it, Would it stir easily? Now what if you put 2 pounds of sugar in it? It's going to be thick, right? That's what happens to your blood. And so when you have a lack of, what did I say pain is a sign of? Any type of pain. What is pain? When you, what do? You get inflammation, right? Doesn't your foot start swelling? You know why it hurts? Not because you banged it. You just messed up the circulation to that tissue. Because what does blood carry? Carries oxygen. What part of the blood carries it? The heme, right? We heard the heme is where the oxygen is. And what is the globin? It's protein. That's right. And globin is protein. Now, if you're having pain in a part of your body, that means you have improper blood flow. What have we been learning? In order to have good health, you have to have what? Proper circulation. Life of the flesh is where? So if you got any problems, what does it boil down to? Your blood, right? And so pain is a sign of a lack of proper circulation to that area. Because, like, for example, we get what kind of pain here? Chest pain, right? That's a sign of a what? Heart attack. Why are you having chest pain? Because the blood is not properly getting to the heart. Why? Because of blockage, right? Pain anywhere is blockage. Did you know that? Pain is blockage. Pain, appendicitis, what's blocked? Your colon. It's blockage of your colon, right? You're stuffed up. Pain is a sign of blockage. And that's why when you hit your foot, they put ice because it takes that swelling down. It helps. What is the purpose of putting ice on your foot? What are they doing that for? No, not really. That does help it, but what is the main purpose? What are they trying to do? They're trying to put the blood down deep into the tissue, right? Yeah, and doesn't ice do that? Heat brings it up. When you take a hot shower and you get pink, why do you think you're pink? Because the water is making you pink? No, I used to think that the water was making me pink. It's because the blood is coming to the surface. Heat makes the blood come to the surface. Cold makes it go down into the tissue. So when you hit your foot, you've got pain, you have blockage of blood, then the ice helps the swelling go down. And it's helping the inflammation so that there can be proper blood flow. Is that making sense? What did you say? Hydrotherapy, absolutely. Let me ask you a question, Pastor and Brother Distant. Well, you didn't grow up in this country when you were young, did you? Do you remember the commercials when you were a little kid? St. Joseph, Bear Aspirin for little children. Or a man had a headache or a fever. Do you remember they had an ice bag on the head, a thermometer out of the mouth, and they had their feet in what? A bucket of water. And he would be wrapped with the towel. That was on national TV in the 70s. You don't see that anymore. So hydrotherapy is very good. But it has to do with the blood. It has to do with the blood. So inflammation, to get rid of inflammation, drink water, exercise, eat properly, all the laws of health that we've talked about. Any other questions? Going once? Going twice? No? Okay. Brother Ron, would you pray for us as we close, please? And we will have classes next Sabbath and Sunday. We're not having classes tomorrow because I have to go back to the chip. Yes, we're done.